Bismillahirrahmanirrahim, a new presentation about improvement. This is Dr. Muhammad Farid Tabib. First of all, we have to define what's improvement. Improvement is defined as a process of a thing moving from one state to another state considered to be better. You should move from one state to another state which is more better than the first one, usually through some actions intended to bring about that better state. You have to do something to reach the better state. If you moved from one state to another better state, it's considered improvement. This is the simplest definition of improvement you can achieve so far. For us here, we are working in the Kingdom of Saudi Arabia, and we have to say that the Sebahi accreditation for healthcare institute is compulsory for all healthcare institutes, and one of the most important thing in the accreditation is the improvement. So the question is it mandatory to do improvement? And the answer will be yes. I'll offer for you here two standards only stated for improvement. You should do improvement inside your facility. First of all is leadership 31 standard in the leadership domain. It stated that the department head ensure performance measurement and improvement of the outcome of the department through regular data collection, doing reporting, and doing some improvement projects. Another example is for quality QM number 1. The first one in the quality domain, first standard stated that hostel leader support a hostel-wide continuous quality improvement program that including to do some quality improvement initiatives and quality improvement projects inside the hostel. And if you want also to the lab domain, you will find that it stated that it's requested to do at least 2 general improvement projects and 2 specialized for the blood bank. So is it mandatory? The answer is yes. We have to do improvement project, mandatory, and is a choice also inside the hostel or inside the primary health care facility. It could be a direction from anywhere also, from supervisors, from higher authority. They can push you to do improvement unless you will do it alone without any directions. What are the most important improvement methodologies well known for us so far? We have Six Sigma, we have TQM, we have Lean Six Sigma, we have Kaizen, PDCA or PDSA or Focus PDCA, the 5 Whys, and the business process management. We have a lot, and we have another methodologies rather than this, but this is the most important and famous methodologies. Best of them, or the most easy one of them, which we are using always in our healthcare facilities, is Focus PDCA. So the question now is why we always using or we are preferring Focus PDCA or PDSA? Because it's simple. Anyone can read it and can follow some instruction, can do it. Any team can be trained very, very easy to use the Focus PDCA. It's easy and a lot of trials. You imagine that you can go to any healthcare facility, you will find some people have a good idea and experiences about the Focus PDCA because we tried it a lot of years so far here in the kingdom. So let's explain what's Focus PDCA stated for and what we will do it in brief. We will not go deeply through it, but we will give a hint and idea about every step. The first step is F, which is stated for find the opportunity to improve. Whatever the people inside hostel or healthcare facility or anywhere calling a problem, we will not call it a problem. We will call it a chance for improvement or quality initiative or opportunity to improve. So always they will say problem, we will name the problem as chances, initiatives, or opportunities. So from where I will get the source of my improvement, what kind of improvement projects I will start to work on, from where the source, it could be from logbox, data from logbox, or OVRs, or SIBAHI results, patient complaints, satisfaction survey for the staff or for the patients, KPIs, indicators, medical record, HIS, higher authority direction. All of those considered a source of starting or initiating an improvement project. How to select? Let's say that we have 6 improvement projects we want to implement this quarter. How can I select in between them which one I will start with? You have 2 choices. Number or maybe more than 2 choices. Voting between the team, executive meeting, for example, they will vote with what to start, or better to use a selection matrix. Selection matrix is a tool. It will help you to prioritize your selection with which one I will start. Again, you can select something related to strategy of the hospital. You can select something urgent. You can select something with a direction from anywhere, and so on. So if you have a lot of improvement projects and you want to select in between them, you can use the selection matrix, which is very important, and we will describe it within few slides. Okay, one more thing: when you are starting to do an improvement project, focus on the improvement project that the chance or the opportunity or the people call problem is high risk. It's impeding risk to your facility, or high cost, it will cost you too much, or high or big volume, it's happening too much, or problem prone, that causing too much problems to your facility. So start with those 4 high. If it's high risk, high cost, high volume, high problem causing or problem prone, you can start with, because it will treat all those risks to your hospital or facility. I'll give you one example here. Tell me what's wrong. So we got from one hospital some types of OVRs. So OVRs related to cleaning with 20, and the percentage of them is 36%. Machine malfunction was 10 OVRs with a 10% percentage of the total percentage of them was machine malfunctioning. Safety, especially electrical things, was 12 OVR with a percentage of 15%, and so on. Now, if you have a statistics or census like this, how can you choose your improvement project now? By 2 things. Number 1, by the bigger number or bigger percentage. For example, we will start with cleaning, then we will starting with electrical safety, then with security, or at the same time, 2 simultaneously. Then you have to postpone plumbers, which is 8 or 6% to the last. We will not say never ever that we will cancel those improvement projects, but we will start with the higher number or higher percentage to start with. This is an example how to find the opportunity for improvement. Let's go now for another thing, to put it in a bar chart to know which is bigger, which is more. Here it's another example for cesarean section percentage through 1.5 years or more than 1 year. You can choose now what's going on. Is it good? Is it deserve to do improvement project or not? So doing a bar chart can assist or can help you to decide which one you will start with, or it is normal, regular, or it is not needed for the improvement. Let's go for a criteria for selection, as we said before: high volume, high cost, problem prone, and media effect. If it's affecting the reputation of your facility, you can start with this improvement project. The second letter for focus PDCA is O. O here is referring for organize the team. Start to make a team. This team can do the improvement. For example, if you have something related to the facility or maintenance, of course you have to put one head of the team, and another one is a facilitator, should be from quality or risk management or patient safety, and the head should be someone authorized to take action to save monies or resources, and so on. And of course, if I'm thinking about electricity or engineering, I should put one engineer, a technician, nurses, because they are included in most actions inside the healthcare facility. And if you have a nurse or something like supervisor for workers, you can put them. This is an example how to choose the team. Team should be around 5 to 6 to 8 persons. Do not put a team within 2 or 3 persons only. It will not be sufficient. Do not put a big team, 12 or more than 15 sometimes, because you cannot control them. No one can control a big number of people in one team. So start to choose your team according to the process you want to improve. For example, if it's something related to medical, both physicians and nurses. If you need pharmacists, if you need lab technician, if it's related to OR, you will take OR people. If it's ICU, you will take respiratory therapist with you, and so on. So you're organizing the team according to the process you want to improve, and we give here one example. In each hostel, we have a team formulation form or application to quality improvement team. Both the team, both the name of the project, why you choose that, and you have to take approval from quality department. Why? Because quality department can align all the direction of improvement inside the hostel, and they know very well the strategic plan and operational plan, and if your project is going or matching with the strategic or operational plan or not. So we have to take an approval from the quality department about our team charter. Team charter means the team formulation form, who's the team, what's the mission of the team, what they have to do, when they have to do it, what the name, and so on. Organizing the team, you have to put the team mission, and I will give you one example here. The team mission should be SMART. I will give you one example. Doing a maintenance plan for all medical instruments in the hospital within 3 months. So you have to tell me what you have to do and what's the time expected or the due date you have to do it. It should be SMART. SMART to goal means S for specific, M for measurable, I can measure it and test it, A for achievable, R for realistic, and T for time bounded. Any improvement project not matching with those 5 letters or a SMART to goal, it will not be sufficient for the quality department, and they will not accept it. Again, common errors some teams will use is quality personnel are the head. They will put the leader also the quality person. It's not good. Quality personnel is always should be a facilitator because he know tools, but no need for him to vote, for example, no need for to be included inside the process, but he have to know the tools and assist people how to use the information to interpret the data and how to do the improvement project. So never ever put a quality personnel the leader unless he is a leader and he's expert and practicing this process inside the hospital. For example, if the quality leader, patient safety, for example, patient safety officer inside the hospital is an ICU consultant or specialist, that time you can put him. Always put a powerful leader with you. Hospital director, medical director, HR director, assistant for maintenance director should be a big director, so he will be authorized to give actions and to support you with the resources. Sometimes missing essential department. For example, you are doing improvement project for DR and you are ignoring people of, for example, neonatology specialist or consultant. He will share with you after the delivery. He will take care for the neonate. So always put him. So never ever miss some important department related to your process and your improvement project. Sometimes some people will do, as we said before, small team or big team, how to manipulate. So 5, 6, 8 is very important. Now, the third step for focus PDCA is C, which is clarify the current process, but flow chart for your process, and this flow chart should be the real what's happening now on the floor, not the imaginary one, not the perfect one, but what happened inside your facility now, so we can know the bottleneck areas, where is the defect and how can we collect it. Here an example for cesarean section. If the patient is coming from OPD or coming from ER, what's happened inside our hostel, no need to discuss it in detail. So the recommendation here is both action, the what's happening, flow chart. Okay, now the name for you also is uncover the root cause. Try to know now the next step is what are the causes of this problem. How to know the real causes, understand or uncover by brainstorming. Brainstorming is a tool. By using a team, this team will give me the maximum number of ideas related to the cause or sometimes for the solution also. So what's happening here in it? Collect maximum number of ideas and thoughts. Some of the most important rule here is no comment, no mocking. Never ever mock at anyone's comment. Do not comment on another one comment. Always build up on. We have two types of brainstorming, structured and unstructured. Structured means you have to take your rule every time, and if you don't know, say pass or I don't know, so we can listen to all the team. Unstructured means that anyone knows anything at any time. He have to stop us and tell his ideas. Every one of them have advantages and disadvantages, but it's not the time now to discuss it. We will discuss it in the quality tools. So the fourth here is to clarify why this problem happening and list all the problem by using the brainstorming. I will give you one example here for our problem in the improvement project related to maintenance. We don't have scheduled, or the people are not committed with the time, no enough number of technicians, all the memos and paperwork is delayed in the superior or supervisors. We don't have experienced technician, we don't have a specialized engineer, nurses are not using it very well, the electricity is not well, and there is no written action plan or a plan for the work here, so we have the defect in the maintenance. This is an example for brainstorming list of the problem. As soon as you have the list of the problem, put them now on a fishbone. Fishbone, we will call it Ishikawa, and we will call it cause and effect diagram. We will put the problem in the head, as you see here, increased number of cesarean section. This is an example. Then you have the main pin of the fish and the side pins and the small pin coming from every one of them. You have to put them under categories like here training, like others, like manpower, like management, and under each one tell me what's wrong with the manpower. It is defective number, or they are not trained, or only resident, or one specialist only, and so on. If it's related to management, tell me there is no policy, or there is policy, no clinical practice guideline, defective antenatal care, no admission criteria. If the training for the people is not well or not ongoing, or is not enough. Others, if you have something else. Some people will use the 5B and 5M in this Ishikawa or fishbone. Actually, there is nothing fixed. You can use 5M, 5B, other things, anything you want to like, but you have to categorize them so it will be very easy to the team to use. I will tell you here, the 5M and the 5Bs. The 5M are manpower, methods, machines, material, and the measurements. And the 5Bs are people, process, programs, products, and policies. You can categorize all your causes under one of those things. But I gave you another example using something else. It's not a rule to use 5M or 5B. It's only to make it easy for you. Here, what's going on with us in our improvement project here? And the cesarean section, why it's high? Because we have no policy and procedure in the facility, defective antenatal care, no departmental orientation. This is the result of our brainstorming. We have to put the frequency of each one, then the percentage of each one, then the cumulative percentage. Cumulative percentage means our percentage with the previous percentage. It's very, very critical, because we can, after doing the brainstorming and getting those numbers, you will do the Pareto diagram. We will discuss it right now. So I will give you only two examples here so we can catch our time. No policy, it happened 245 times with a percentage of 35%, which is still 35 in the cumulative. The second is defective antenatal care. It happened in 168 times, which is representing 24%. But here the cumulative is 24 plus 35, which is 59, and so on. After we will finish this one, putting them in a table, cumulative table, we will put now Pareto. Pareto stated that 20%, he said that 20% of the problem will be, if we correct 20% of the causes, we will improve 80% of the outcome, and so on. We will call the 20 is the vital fuse, and the 80% is the useful mini or trivial mini. this is a very, very, very excellent prioritization tool. I will prioritize the causes, or I will prioritize even the solutions. Here, after you put all of them with a percentage totally 100%, you have to focus with the first 80%. If you correct them, or 75%, if you correct them, you will correct almost all the trouble. You will start with them. We will call them vital few, but the others, we will correct them. We will work up on them, but later on, and we will call them the useful many or trivial many. Now we have to do select. Select now the remedies, what you will do to improve the problems listed in the brainstorming. For example, here they stated that we will put a plan, we will do a training program for the technician, a training program for the nurses, and increase the budget for the consumables. How could I start with which one? We have now 4 things. I can start with them 4, yes, but it will be a loss of time and effort, so it's better to start with something important than the other one. How could you prioritize your solutions? You have to score them, put a score for every one. For example, put a score from 1 to 5, which is 5 is good for you, 4 is less, 3 is less, and 1 is the least for you, and so on. So let's go for example here. If we said that we are putting a plan, it will cost me nothing, so I will give it 4. The leadership will support me in the plan, like revision, like approval, like helping me in the training people over them, by 4. So it's excellent, so it's 4. Time, it will take 2 weeks from me to finish everything, so it's 5. Acceptance by staff, a new plan that we do not have before a plan, so they will accept 4. If you put all numbers, try now to multiply them by each other to give you the net score. The net score, or the total here, is 400. By the way, you can use only 1 selection criteria, 2 selection criteria, 5 selection criteria, according to what you need. Then go to the second step, do the same, third step, do the same, and the fourth step, do the same. I'll give you one example here also for increasing the budget for the consumables. Cost, it will cost me too much, so it's not easy for me, so I'll not go 5, 4, 3, I'll give 2, for example. Now we will go for leadership support. They will also not supporting me that much because they need money. Time, it will take too much time by raising memos, later coming, later going, and so on. By acceptance by staff, it will be perfect. If I multiply 2 by 2 by 1 by 5, it will give me 20. Now, with which one I will start? With the biggest score. So first I will start with the plan. Then I will start to make a training program for nursing, then training program for the technician, then at last I work on the increasing the budget for consumable. Now this is the selection criteria, which is the most important selection criteria for you, or selection tool with you. Now the next step is P. P means a plan, putting action plan. Tell me what you have to do, like putting a policy, who will do it, which is the due date for it. Last time I can assure that you finished it, and tell me the measurement. Measurement means when I'm coming to you, I will find a written policy, approved, people trained on it, and a monitoring form, you are doing it, and so on for all your steps inside the improvement. This is P. Now show me the new flow chart after modification, after you modified your action plan. Here, as you see, there is a totally different from the first one. We make something short here. We save time here. So still in P, putting the action plan and the new flow chart, do try to implement the recommendation on a small scale. For example, on one only department. If it succeeded, generalize it all over the facility or the hostel. If it's not, if it's failed, try to revise back your selection criteria or the action plan or the causes. You may find something wrong. Then after correcting it, again on a small scale, then if succeeded, generalized scale. So do for doing it. The second or the next step is check the results. After you did the improvement, is it working? Did you succeeded or not? By measuring the same measurement before you doing the improvement. Here we said that, for example, for one entity improvement project, we are talking about the problem is cesarean section rate is between 35% to 40+. and the aim is to reach around 25%. After they did the improvement, they measured 3 months, they found it 28%, 25%, 27%. So you succeeded, of course. We will call this one the benchmark. The benchmark is the number you are trying to compare yourself with. Last is act on the gain. Maintain your gain. Act on the results. Maintain your gains. Anything you catch, never ever stop the improvement. You don't say that we reached the result. Khalas. No. That time, if you stopped, everything will go back again. So try to do it. How? By ongoing education and training for the staff, monitoring the KPIs, review your policies, do satisfaction survey for staff or for a patient, orientation program. This is examples for how can we maintain the gains of us. I'll give you here some examples for some common initiatives or projects, because a lot of people sending it to me that we cannot initiate an improvement project. We don't know the name, how to do it. I'll give you here 10 examples. Reducing healthcare acquired infection from that number to that number, or from that percentage to that percentage, through a fixed time. Put the time here. Increasing medication error reporting among a physician from that percentage to that percentage within a fixed time. Reduce bed sores or pressure ulcer inside ICU from that number or that percentage to another through a fixed time. Increasing patient satisfaction about OBDs services from that percentage to that percentage within a fixed time. Reducing waiting time in a dental clinic from number to number within days. Completing percentage of staff files within that time. Reducing TAT, turnaround time in lab, from 60 minutes to less than 20 minutes by the end of next January or July or whatever. Increasing physician documentation inside medical record after you did, of course, the medical record review, from 60% to 80% compliance within 3 months. Reducing VAB, ventilator associated pneumonia, to less than 10 per 1,000 mechanical ventilation days through 3 months. Reducing DAMA, discharge against medical advice, from ER from 36% to 15% through 6 months, and so on. And by this slide, we reached our end of our presentation today. Thank you very much for listening and attending. Inshallah, we will meet very soon for another presentation. Thank you very much. Until we meet again. Assalamu alaikum wa rahmatullah.